Healthcare and insurance are terms that are often used interchangeably. However, healthcare, which usually includes elements like ER visits, preventative medicine, and prescribed drugs, is way different than insurance, which provides coverage for medical services. Where it can get confusing is how healthcare is delivered. Not everyone that seeks healthcare services have insurance. Those that have insurance might not have private insurance, but instead may have health coverage through the government or organization memberships. It is important to know the similarities and differences between healthcare versus insurance before choosing a policy. Healthcare definition. Healthcare is defined as efforts made to take care of or restore mental, physical, or emotional well-being by licensed and trained professionals. It typically includes primary, secondary, tertiary, and quaternary medical treatment. Healthcare delivered to patients may include any methods or procedures designed to worry for a patient. It also includes the diagnosis, treatment, and prevention of disease. Healthcare is not just limited to traditional medicine. It also covers dentistry, optometry, pharmacy, nursing, allied health, and similar areas of health. Due to advancements in science and technology, the sector of healthcare has grown significantly in recent years. The industry during which medical professionals or practitioners add is usually mentioned because the healthcare industry. The healthcare industry is formed from doctors, nurses, therapists, dentists, pharmaceutical companies, and hospital systems. When these professionals set prices for his or her products and services, it's an immediate effect on insurance costs. Through professional healthcare services, patients are ready to not only receive treatment for his or her illnesses and ailments, but also receive any necessary guidance or treatments for preventing illness and disease in the future. Types of healthcare. Primary care. Medical care is the most recognizable sort of care during which you see your healthcare provider to deal with symptoms and medical concerns. Primary care is additionally liable for coordinating your care with specialists. Secondary care. Once you've got been mentioned a specialist by your healthcare provider, you're in secondary care. This means that you will be cared for by someone who has expertise in the field in which you are having health problems. Tertiary care. If a patient requires hospitalization, he or she could also be mentioned tertiary care. This type of care requires specialized expertise and equipment. Quaternary care. Quaternary care is simply an extension of tertiary care. It is highly specialized and thus only offered by certain providers and hospitals. Home and community care. Home and community care refer to a good range of health services designed to satisfy a person's medical needs, like skilled medical care, dietary management by a dietitian, and occupational, physical, or speech therapies. Urgent care. Urgent care centers provide patients with quick access to health care sometimes when their normal health care provider might not be available. Urgent care centers are often open during non-business hours, such as nights, weekends, and holidays. Health insurance definition. An insurance application that a family will fill out. Health insurance is defined as a system of financing used for medical expenses. It is designed to assist absorb or offset healthcare costs related to a good range of services, like routine health examinations, unforeseen illnesses or injuries, inpatient and outpatient surgery, specialist referral visits, and prescription medications. Health insurance policies are generally separated into three main types. Privately paid by a private, commercially arranged as a part of an employee benefits package, or publicly provided as a service through Social Security. Insurance policies can differ from company to company, and every has their unique set of criteria for providing coverage. Health insurance may include coverage for a good range of illnesses and injuries, like accidental loss, mental disease, and disabilities. With insurance, the insured is usually reimbursed for expenses that incur thanks to an injury or illness. Health insurance premiums are deductible and any benefits given are without tax. Health insurance are often difficult to navigate thanks to ever-changing laws and differing policies from one insurance firm to subsequent. It is important to understand your options when comparing traditional insurance and managed plans to work out which policy is best fitted to your unique healthcare needs. Types of health insurance. Basic medical insurance. Basic medical insurance plans typically offer less coverage with the trade-off of lower premiums. After paying a premium for coverage, members receive sufficient funds to reimburse them for events like doctor visits, surgery, and lab tests. Major medical insurance. Major medical insurance generally covers quite just doctor appointments and surgical procedures. These plans can also cover other services like physiotherapy, home care, and rehab, also as prescription costs. Disability income insurance. Disability income insurance provides eligible disabled individuals who aren't ready to work with periodic payments of advantages. With this sort of insurance, 45 to 65% of a person's gross income is replaced on a tax-free basis. Long-term care insurance. Future care insurance helps buy expenses related to long-term care. It often covers care that's not otherwise covered by Medicare or Medicaid. Critical illness insurance. Critical illness insurance requires the insurer to form a cash payment if the policyholder is diagnosed with a selected illness found on a predetermined list. Hospital cash insurance. Hospital cash insurance can provide financial protection by delivering daily cash benefits throughout the duration of the insured person's hospital stay. Healthcare versus health insurance. A health insurance broker discussing different types with a business owner. While the confusion between healthcare versus health insurance may not seem important, knowing the differences between the two can have a big impact on your choice of policy. Health insurance, when understood, allows policyholders the ability to protect themselves from unpredictable future healthcare costs at a reasonable cost.